Dance, cheerleading, music. 11-year-old Clara Phillips does it all, but a visit to the orthodontist forced her to take a break. Her parents received some unexpected news.
She was just having x-rays. It was a pan x-ray of her jaw and face. And that's just something typical that they do for anybody that's going to start getting braces.
The orthodontist called me up, and I assumed it was just a normal call. And he said, I don't want to alarm you, but we saw something on Clara's film that needs some follow-up treatment. And he said, your pediatrician, I already had a conversation with her. She will be calling you shortly.
Then David spoke to the pediatrician.
And I said something to the effect, can you give me any more information? Because, I know my next call was to Beverly and she needs more information. So he said, well, there was a spot or an anomaly, I think might have been what she called it, up on the top of the head that we just need to look more into. So I called Beverly real quick. I think she was on her way home from work.
I could tell that by his tone that something had happened, and he said, before I start, he goes, I heard less than 10% of what I'm about to tell you.
Told her, the orthodontist called, the pediatrician called. There's something going on and we need to get follow-up x-rays.
So our first process was to just get a repeat film x-ray. Unfortunately, the repeat film x-ray did verify that there was something. They called it the right parietal part of her brain, so right up in here. And they didn't know if it was brain or if it was skull. They couldn't really tell by that, and that she would need to have further studies.
News that wasn't easy for Beverly and David to tell their young daughter.
They told me that that there was something on my head that the doctors had to get removed.
I have a medical background, but I was not able in any way, shape, or form to look up anything about this. I'm sorry.
2 o'clock in the morning when you start to think about, after thinking about this over and over again, what is this, what's going on? It's pretty scary.
Doctors referred Clara and her family to Hershey Medical Center.
I told them I thought it was some type of skull mass lesion, something that was eroding the skull from inside the bone, and that the majority of those lesions are benign.
He said, I've seen it before. We're going to deal with this. We're going to get taken care of.
We told them that we felt we needed to excise the affected area of bone to prevent it from spreading and creating a larger defect, and that we would plan to close that. We felt the best option for her, given the size and location of the defect, was implant. So it's a special type of plastic implant that's made by one of our companies that we work with. It is custom fitted to the patients.
Since it was my first surgery, I felt a little I just didn't really want to have the surgery. I just didn't want any of that to happen in the first place, but they did say that everything would be okay.
Doctors used a navigation system like a GPS on Clara's head to make sure they removed the entire lesion.
It was very important in this case because even with the bone exposed, you couldn't tell exactly where the margins of the lesion were because it wasn't visible from the exterior of the skull.
Once we're assured that it's completely out, then my job is to reconstruct the skull to essentially protect the brain. Her implant was roughly about 5 centimeters by 5 centimeters, and it was up on the curve of the skull. We use plates and screws that are made of a titanium alloy, and these are less than 1 millimeter thick. So when you put these on, the implant stays in very rigid, stable position, and you would not be able to feel this when you have the scalp closed over top of it.
She went in at 7:30 was when we said goodbye to her, and right about 10:30 was when Dr. Sampson, Dr. Iantoski came down to the waiting room to give us the highly favorable news that everything was as expected and that she did really good.
Her scar looks fantastic. You're not even going to be able to see where it happened. She did great through the whole thing. There was minimal blood loss.
Moments later, they were able to watch Clara wake up.
She was sleeping like a baby, and after about 15 minutes, I see a big blue eye open up. Great feeling.
When I saw them, I was actually really happy to see them because I didn't like surgery a lot. I just wanted to go home, but I still had to stay there another night.
Clara spent one night in the hospital and returned to school days later.
The fact that a surgical procedure could correct this and that she didn't need to go through anything else, no radiation, nothing that altered her in any way, shape, or form, nothing, was huge. It was huge for us.
I feel glad and relieved that no one can see it, because it'd be kind of weird to just walk around school and people noticing that I have scars right there.
Clara, she's doing good. The process has definitely done something for her, and she's doing great.
She's great. She's great. I can't say anything more than that. She's great. She could not be better. Honestly, she could not be better. You can't even notice that it happened. She's doing well in school.
I feel really glad that I don't have to worry about it anymore. I just feel glad that it's over and I don't have to have surgery for that ever again.
We interviewed Clara 17 days after she had surgery. You would have never known she went through this kind of procedure. Good news, pathology results showed the lesion was benign. Joining us is Clara's plastic surgeon, Thomas Sampson, and also plastic surgeon Dino Ravnik. Thank you both for being here. What an incredible story. To think that it was through the orthodontist. How common are these lesions in children?
Yeah, that's a great question. Actually, these kinds of lesions are very uncommon in the general population. Being at Penn State Health, we get a fair amount of referrals from the mid-state, which is the reason that we're able to see many more of these kinds of cases, and essentially over the course of a year we'll probably do about 10 to 15 of these types of surgeries.
And Dr. Sampson, what are the long-term implications of using 3D printed implants in patients?
The 3D printing has really changed the way we reconstruct these. We used to use the patient's own skull, which would require a much bigger incision, a much bigger surgery, bigger recovery, and with not the same kind of consistent results. So using the 3D printed implants, we're able to get the patients back to work, to school, to play, with long-lasting results that truly should stand the test of time.
And we certainly saw that in Clara's case. Yeah. Now, as we're talking about bioprinting, this really involves you, Dr. Ravnik. Talk to us about your lab and the futures that you hold there.
Yeah, so as plastic surgeons, our job is to really reconstruct all types of defects that are caused by cancer or congenital defects or trauma, for example. And as plastic surgeons, we're trained basically in the principle that we try to use extra tissue to restore those defects. Our lab really focuses on using excess tissue as spare parts to retrieve the cells, typically adult stem cells, that we potentially hope to be able to use as bioink for the printing process, with the idea of building tissues and organs in the lab eventually in the future for a customized replacement for the patient.
Wow, how exciting is that? And Dr. Sampson, what other cases and clinical situations would you use this same type of implant?
Yeah. So this type of 3D printed implant can be used in trauma situations where great segments of the skull have been lost. Cancer patients who have lost large portions of very difficult contoured, as in these cases. The 3D printing allows us to get, again, a custom implant that matches perfectly to the opposite side. And when it's done, as in Clara's case, you would never be able to tell that anything was actually done. And that's the goal.
Okay, and Dr. Ravnik, we have time for one quick viewer question that came in. And it says, with the advancements in 3D printing, can this technology be used for correcting congenital defects or for vessel replacements?
Yeah, it's actually a technology in progress. It continues to be developed, and our pillars are using the manufacturing technique of 3D printing, which we do with our collaborators at University Park, but also advances in cell biology and surgical and microsurgical techniques to integrate all these components, and it really can be applied to really any of those conditions that you mentioned.
Okay, lots of really great information. Thank you both